Good morning, everybody. This is Dalton Benson, the acting planning section chief for this week. Welcome to the Anchorage Emergency Operations Center external operational update for March 30th, 2021. A reminder, drive to decline, wear your mask, get the vaccines. We'll start with the situations.
Good morning, this is John Cecil, Information Management Specialist. This is your situation update for March 30th, 2021, day 391. For Alaska, 59,710 cases, an increase of 327, 309 deaths, an increase of 1,340 hospitalizations, an increase of 4. For Anchorage, 27,574 cases, an increase of 132. Deaths, 164, remains the same. Hospitalizations, 734, an increase of 1. Next slide, please. For 213 resource requests, filled and satisfied, 1,715, an increase of 2. Open and working, 18, an increase of 1. Sheltering, total congregate, 418 clients, a decrease of 7. Total non-congregates, 340 clients, a decrease of 4. Total all shelters, 758 clients, a decrease of 11, with 2,274 meals served per day. For testing over the weekend, 326 to 328, 1,198 sample collections, 54 per hour. Over the last 7 days, 323 to 329, 5,147 sample collections. These are from the last external brief on 325. For vaccines, 23,839 doses to date, an increase of 1,190. For the blood bank, 6,040 doses to date, 571 increase. For Dempsey, 2,178 doses to date, an increase of 454. Shiloh, 818 doses to date, increase of 412. And Visit, 682 doses to date, an increase of 107. End of report.
All right, so we'll move on to operations.
Good morning, everybody. This is Rick Meredith, Operations Section Chief for the EOC. In our mass care department, we have Q&I that had 18, will have 18 projected discharges through Thursday and 4 of them today. And our warming tent had circulating last night, 85 people over the last 24-hour period. Our numbers are kind of consistent with traditional balances across our sheltering system, but we expect a little exiting as the weather warms up and people start exploring more outside. In our public health branch, we had an increase over 3.29 over the previous week's sample collections, but that's still decreasing kind of concurrently as we've gone for the last couple of months, and that's tied to people not getting tested as much because they've got vaccination. So we're working on messaging with that. The positivity rate's at 3.43, and we keep trying to drive that down as low as we can. Below 1's a great place to be. For our testing locations, on the 30th and 31st, 800 K Street from 08 to 1900. On the 1st at UAA Wendy Williams parking lot from 08 to 1900. And on the 3rd on Muldoon Elementary School from 08 to 1900. Our medical countermeasures, Hotel Captain Cook event went very, very well. We had over 1,000 over the weekend, so it was a good indicator for them. Visit Healthcare will be going into the Forever 21 at the Diamond Center. We're looking at a grand opening on Thursday, April 1st with hybrid appointments available and walk-ins, so we can kind of get both things done. We'll be going 7 days a week. The Diamond Center is going to be supporting them with multiple events in terms of looking at some free coffee and helping to celebrate those people getting in there and getting their vaccinations. The media campaign will be spearheaded by Visit and Diamond Center in messaging one step closer. And we're looking at a new drive-through location on the 12th at the Northway Mall. The Alaska Airlines Center Fairweather will be doing a pop-up event at South Restaurant tomorrow from 2 to 5, and all nearby businesses and clientele are being invited. Pinning your question, that concludes my brief. Thank you.
All right, thank you, operations. Logistics.
Hey, good morning. This is Scott Carpenter, the EOC Logistics Section Chief. For medical countermeasures, we continue to support vaccination sites for indoor, drive-through, and mobile teams, etc. For mass care support, support as required, nothing specific on the radar for this group. And in the EOC, we continue to support staffing requests for additional personnel with 2 folks coming on board this week.
All right, thank you. Logistics, finance.
This is Carrie Wiedeker, the Finance Section Chief. Currently, the EOC has encumbered $21,545,559. Our actual spent today is $42,784,765 for a total of $64,330,324. Please continue submitting any invoices and supporting documentation to EOC invoices at anchorageak.gov. The Office of Emergency Management does continue to seek cost recovery for expenses in the form of FEMA public assistance. If you have questions or require information about that, please contact aaron.zachary@anchorageak.gov. End report.
Safety.
Good morning. This is Annalisa Roberts reporting out for safety. So on the screen, there's 11 signs of, or 11 stress symptoms that you need to know about. So stress, unfortunately, is unavoidable and everyone experiences it at some point. The actual definition of stress is a feeling of emotional or physical tension, and it can come at any event or thought that makes you feel frustrated, angry, or nervous. So the COVID pandemic is something that probably makes people feel pretty stressed out at times. So just watching for these symptoms, it doesn't just affect the inner part, but it also can affect the outer part. So looking at the symptoms, looking for gray hair, irritability, heart problems, nausea, difficulty concentrating. Sorry, I didn't finish that one. Tension headaches, skin issues, changes in physical motivation, and changes in digestive system. Just because you have one of these, though, doesn't mean you're overly stressed, but just watching out if anything changes, knowing how to get a good grasp on the stress and trying to meditate, do yoga, anything that helps calm you down so that you can be better physically and mentally for your job or for your kids, family, anything that will work for you. End report.
Public information.
Hey, good morning, everybody. Kel Casey here reporting out for the EOC PIOs. We maintained a robust social media presence over the long weekend, promoting Hotel Captain Cook, as well as the Shiloh clinics. We are coordinating with the Anchorage Health Department PIOs to meet with Ivan Moore to drill down on the survey data and build a strategy that overcomes hesitancy based on the data from that survey. Spanish TV ads promoting the vaccine that were made by HSS are now running on Telemundo and other stations in our market. We're following up on any media requests. We're continuing our outreach strategy that includes underserved, multi-generational, and vaccine hesitant. So if you have any photos or videos of your friends, family, anybody that you can share with us, we'll build them into our strategy to make it more human. And we're continuing our daily outreach to influencers. That did actually go out on Monday as well. End report.
Liaison.
Good morning, everybody. This is Rick Meredith standing in for Celeste Prescott. Thank you to all of our partners who are able to join us today, and welcome to the 673rd Medical Group Command and Control Team. We're happy that you are able to be here and join us for the next couple of weeks. And let's get started with our hospitals. Is there anyone on the line for Alaska Native Medical Center?
Good morning. This is Kirsten Cole with Alaska Native Medical Center. This morning we have 3 positives. 2 of those are in our ICU. None of them are on ventilators, and 0 PUIs. End of report.
Thank you. And Alaska Regional Hospital?
Good morning. Alaska Regional Hospital has 4 COVID patients, 3 still in isolation, 1 in the ICU, and that person is vented. Currently, no PUI.
Thank you. Providence Alaska Medical Center.
Good morning. We have 9 COVID patients, positive COVID patients, 7 recovered. One of our positives is in the intensive care unit. No one is on ventilation.
Matsu Regional Medical Center, which is unable to join, is reporting 10 positives, 6 in ICU, 3 on vents, and 0 PUIs. That's all for liaison. Thank you.
Anchorage Health Department.
Hi, this is Janet Johnston, epidemiologist with the Health Department. So at the end of last week, we increased the overall COVID risk level from the top of the considerable risk to the low end of the high risk. The reason for that is that we are continuing to see the daily case counts increase. And along with that, the effective reproductive number is also increasing. We're up around 1.1 for the effective R0, which means that for each person infected, we're seeing a little more than one new case following after that. We've also seen a slight decrease in the availability of staffed ICU beds, and the CDC surge model that we use to project healthcare capacity is also showing a slight increase in risk. My biggest concern is that even though vaccine coverage is continuing to increase, we are also seeing cases continuing to increase. And we think that that has to do primarily with people starting to be more mobile as we relax the emergency orders, and the fact that the vaccine distribution is not uniform across the municipality. So we have areas where we're getting a lot of vaccine coverage, but we also have areas where we've got people who are infected and they're interacting with people who are not vaccinated. So it's really important that we get people to get vaccinated as quickly as possible, and to not wait, particularly people who are thinking maybe they want the J&J vaccine, but we don't have much of that. Don't wait, get that first shot. End of report.
Thank you, Janet. Incident Command.
Good morning. First, I'd like to, this is Instant Commander Bob Dole. First, I want to do a shout out and echo some of the comments in chat to the great support we got for the Captain Cook event. Also with the local community there coming to support, over 1,700 shots being given there, which was an outstanding event in terms of reaching a group that we weren't otherwise reaching. Also want to thank Dr. Johnston from Health Department coming out and sharing her words with us. Key to our going forward successfully is understanding what we're going forward against, and the epidemiology knowledge is really important as we cater our operations to get where we need to go. We all here on this call are dedicated to getting back to normal. And normal means where we move on with recovery, and COVID protective measures are not what's constraining us. I want to thank this group for everything they're doing and urge that for the hesitant out there, that we remind them that the path to normalcy starts with getting beyond COVID. End of report. Thank you.
Thank you, Bob. The next operational briefing will be Thursday, April 1st at 10 a.m. Thank you, everybody.